patient undergoing a cardiac stress test begins experiencing dizziness, shortness of breath, and chest pain. What is the most appropriate immediate action for the medical assistant? Meaning that there might be other responsibilities or tasks that you do right after, but what is the most important first step that you should take right now? And in order to come to that conclusion, we want to focus on this part. All of the symptoms that the patient is experiencing during the cardiac stress test, which is a test of endurance using the treadmill to see how their heart and how they react to the test. Now, if we see symptoms like this, do we think that these are mild symptoms that maybe can be continued to be monitored in the office stay? Or do you think that these are more serious symptoms that need more of an emergency intervention? And they should raise a lot of red flags because these could be related to an impending heart attack. So let's look at the options and see which would match what you would do in this case. So option A says stop the test, place the patient in a supine position, and obtain vital signs. And this seems exactly like the steps of what you would do. You always want to stop whatever you're doing when you have any sort of severe reaction. And this goes for any sort of testing, any sort of intervention that you're doing. If the patient has a very severe reaction to whatever is being done, you don't want to continue. You always want to stop. So this looks good. And then afterward, place them lying down or supine and obtain vital signs. And yeah, after you get them situated, you want to see the vital signs because this will be important to the provider to know what to do next to best help the patient. Additionally, it's important that you have the patient lie down in a supine position because if there's any chance that they could pass out, you don't want them to fall and hit themselves. If they're already lying down, then that's a safe spot for them. So option A is looking good. We'll go with that, but let's go through the other choices. Option B says decrease the treadmill speed and observe the patient's response before deciding to stop the test. And this wouldn't be correct in this case because when you see such severe reaction like this, you want to stop immediately. Maybe you would consider doing something like that if they had some sort of a milder reaction. Maybe if they say, oh, you know what, I think I'm starting to get a little bit tired. You could ask the patient, do they want to take a break? And if they say they want to keep going, but that would not be in this scenario at all. So we want to eliminate option B. Option C says encourage the patient to continue since mild symptoms are expected during a stress test, but these are not considered mild symptoms. These are severe symptoms. These are not good. This could be signs of an impending emergency, and therefore you want to stop the test. So eliminate option C. And then option D says notify the provider while allowing the patient to continue at a slower pace, and absolutely not. You do not want to have them continue. You want to stop the test. So don't get fooled when you see the beginning part, notify the provider. You want to read the rest of the answer choice because it would not match in this case. You will notify the provider while you're watching the patient. You could call for someone to get the provider as you do option A, stopping the test, placing in a supine position, and obtaining vital signs.